Drug absorption process. So drug absorption here defined as it is a process by which an unchanged form of the drug moves from its site of administration into the systemic circulation. Means when any drug is administered to the body, it moves to the bloodstream in a unchanged form. So in this diagram we can see the drug is moving towards the bloodstream from the site of administration. So whether it may be oral route or it may be parenteral route, whatever it may be, the drug absorption is defined as it is a process by which drug in the unchanged form it moves from its site of administration to the systemic circulation. Hello everyone, welcome to my channel. In this video I am going to focus on a new topic called as mechanism of drug absorption. So in this video we are going to see various mechanisms through which the drug is going to absorb in the body, like diffusion mechanism, active transport system, then pinocytosis, then endocytosis, then facilitated diffusion, etc. There are different mechanism of drug absorptions are there. Drug will absorb in the different mechanism, like passive diffusion is there, facilitated diffusion, active transport system, then endocytosis. Another one is there that is called as pinocytosis. Then passive diffusion of the drugs. So here passive diffusion means it is a natural movement of the drug molecules across the cell membrane without any help of any energy. So here in the diagram you can see the drug will moving without any effort or without any energy. Means here the drug which is movement towards the inside of the cell without any energy or without any active molecule. The drug is just diffusing from the region of higher concentration. This is the region of higher concentration. It is moving towards the region of lower concentration. Then what are the key features of this type of diffusion? So here there is no energy required, means there is no ATP molecules are required, and there is no carrier proteins are involved in this mechanism. Then the drug movement is from higher level to the lower concentration. Then it is a non-selective, means there is no specific selection of any in this mechanism is there. So it is mainly depend on the drug properties, like the size of the drug molecule and the lipid solubility of the drug and all, and how it is going to work. So there is a step-by-step process here. So the drug from the higher concentration outside the cell, it moves directly through the membrane. So it continues until a balanced until there is establishment of the balance on the both side. That is the when it is attain the equilibrium, the diffusion of the drug will stops. Fix first law of diffusion. So this law describes the rate, or you can say the speed, by which a substance diffuses across the concentration gradient, So mathematically it is expressed as follows. So here we can see the equation is there, that is capital J is equal to minus D into dC by dx, where J is equal to diffusion flux, capital D is equal to diffusion coefficient, and dC by dx is equal to concentration gradient. Here the negative sign indicates that diffusion across from the region of higher concentration to the region of lower concentration. Here there are 2 points which is to be noted here. Here flux refers to rate at which the substance moves across the cell surface area. Means here flux means the speed or the rate at which the substance moves across a surface area due to diffusion process. Then another point, that is diffusion coefficient, that is capital D. So it quantifies how easily substance spreads or moves through another medium due to molecular motion. Here we are going to describe a simple equation or express a simple equation. Uh, First one is small h is equal to a membrane of thickness, means the small h represents thickness of the membrane. Then another term CD refers to concentration of the drug at the donor side, Then CR represents concentration of drug on the receptor side. Let us assume a steady state, the gradient becomes, we can express in this form of equation, that is dc by dx is equal to cd minus cr divided by h. So same thing we can write in this way also. We can take dc by dx as j is equal to capital D into cd minus cr divided by h. Then the total absorption rate. Now to find the total amount of the drug absorbed with respect to time, we can multiply flux by the area of the membrane. So now the equation will be rate is equal to J into A, that is J means flux into area is equal to dA into CD minus CR divided by H. So this is a core equation for the drug absorption by the passive diffusion. By using this equation we can calculate the rate or the speed of the drug absorption across the cell membrane. Then next, that is active transport system. So it is the another mechanism of drug transfer. Here the drug is carried by some carrier molecules, means active transport is like a delivery truck carrying the drug molecules against the traffic. So here it is not easily transported, means here we require carrier molecules. The drug is not easily moves from the absorption site. Here what happens, here some carrier molecules like that is ATP molecules are there. Here ATP molecules are there in the diagram. Here the drug is going to diffuse in this diagram into the cell. The drug is going to it is going to carry by the ATP molecules from the outside to the inside of the cell, and it is the against concentration gradient, means it is low to high, whereas in case of diffusion process it is reversible, that is high to low. The concentration where the drug is more, from that region the drug is going to diffuse, but here entirely different, that is from high region to the low region, means here when we see the key features, it needs energy. What is the difference between diffusion and active transport, means there it is that is energy independent. Diffusion is energy independent, but it is energy dependent because that it requires ATP molecules. Then moves against the concentration gradient, that is low to high. Then it requires carrier proteins. Then it is highly selective. Only specific drugs are transported by this mechanism. How it is going to work step by step? So drug is in low concentration outside the cell, then carrier proteins grabs the drug, and that is energy ATP helps to push into the cell, then drugs reach the higher concentration inside the cell. So as we see in this diagram, so here are the drug molecules inside the cell. It is grabbed by the ATP molecules. The drug is grabbed into the cell. So example for this type of mechanism is levodopa, which is used in the treatment of Parkinson's disease. Another mechanism is there, that is facilitated diffusion. So what is facilitated diffusion here? It is a type of passive transport system where the drug is moving across the cell membrane by the help of carrier protein. But the difference is here there is no use of energy, that is there is no use of energy molecule, that is ATP, and it happens down the concentration gradient, that is from higher to lower, just similar to the passive diffusion. And it is useful for the drugs that are too large or too polar. Here polar means the drug molecules having unequal distribution of charges. Unequal distribution of charges, they are called as polar groups. This mechanism is followed by the drugs which are larger in the size and too polar. There is an example for this type of mechanism, that is transport of glucose analog drugs. Let's take an example, that is D-glucose and its analog 2-deoxyglucose, which is used in the research of cancer. So these molecules, they are hydrophilic in nature, means they are water loving, and they cannot cross the lipid bilayer, because to pass the lipid bilayer it should be lipophilic in nature, that is lipid loving, means lipid soluble, but it is hydrophilic in nature. It is easily, it cannot pass. But to cross that membrane or barrier, it use a transporters called as GLUT transporters, that is glucose transporters, to enter the cell. These drugs are similar to the glucose, that is they mimic the glucose and enter the cell via facilitated diffusion through the GLUT proteins. Now endocytosis or cell swallowing of drugs. So endocytosis means when cells eats the drug, that is swallowing of the drug molecules. How means by wrapping them in its membrane and pulling them inside. So in this diagram we can see cells engulf or swallow the drug particles or drug molecules. So now what are the key features of this type of mechanism? So this type of mechanism requires ATP, that is energy molecules, that is adenosine triphosphate energy molecule, which is required for this type of mechanism. Then cell membrane surrounds the drug. Suppose here is the drug, then it is surrounded by the cell membrane. Then it after engulfing the drug particle, it forms a tiny bubble which is called as vesicle. So in this diagram we can see there is a tiny bubble like structure, that is called as vesicle, to carry the drug particle or drug inside the cell. Then it is used, this type of mechanism is followed by larger particles or larger molecules. If the drugs having the larger particles or larger molecules, then this type of mechanism takes place, and it is specific. It is not common to all. Only a particular type of drugs will be get absorbed by this type of mechanism. Then how it works? First, the drug comes near to the cell surface, means the drug will come near to the cell surface. After that, the cell detects the drug by using some receptors. Then this cell detect this drug molecule by some receptors. Okay. Then this cell will grab this drug particle and engulf this drug particle, and the drug molecule will be get inside of this cell, that is grabbing or wrapping around the drug. Then there is a formation of bulb structure which is called as vesicle and pulls the drug particle inside the cell. That is, after engulfing the drug particle inside the cell, it will form a bulb like structure, bulge-like structure that is called as vesicle that will pulls the drug particle inside the cell. As you see in the diagram, here the drug particles are pulled or get inside the cell. That is there, that is pinocytosis. What is pinocytosis? It is nothing but cell drinking. In the endocytosis, we have studied a cell eating. Here, pinocytosis means cell drinking. So, in this type of mechanism, cell engulfs extracellular fluid and the substances which are in dissolved form or soluble form, forming small vesicles. So key features of this type of mechanisms is it is non-specific, means it is no that is it is does not have any specific selection. It is non-specific and it requires energy, that is ATP molecule, that is energy dependent molecule. Energy dependent mechanism. Then common cells that need to absorb nutrients from these from their surroundings. So here we can see the step-by-step process. So first the cell membrane forms a small packet around the fluid outside the cell. Then pocket deepens and pinches off, forming a vehicle. For example, assume that here there is a cell and there is a extracellular fluid present outside the cell. Here is the extracellular fluid present outside the cell. Here is a cell. So now what the cell will do means this cell will forms a or you can say the cell will form a small packet around these fluid, and this fluid is get absorbed inside of the cell by forming a vesicle and the dissolved solutes and the extracellular fluid get inside of the cell in this cell. Then the contents are processed and used by the cell. So here we can see in the diagram, the cell, this is the extracellular fluid which is absorbed by this cell by forming a vesicle, and that is cell drinking, and the extracellular fluid will move inside the cell and it is used by the cell. This type we can see the example of intestinal absorption, especially the nutrients like vitamins, amino acids which are dissolved in the fluid, and oral drugs which are water soluble, especially water soluble and present in the solution form, are absorbed by this type of mechanism, that is pinocytosis. Then after that, here we can see the comparison table between the endocytosis and pinocytosis. So what is the difference between endocytosis and pinocytosis? Endocytosis means, as I told you, that is cell eating, and pinocytosis means cell drinking. So it shows the eating process of the cell, it is about the drinking process of the cell. So definition, when we see the definition in the endocytosis, uptake of external substances here by formation of vesicles. Here uptake of extracellular fluid, here is the external substance, here is the extracellular fluid and solutes. Then type of material taken here, only solids, rarely liquids, then larger molecules. Here only liquids but now solutes, but the dissolved solutes which are present in the liquid form. Then subtypes, so phagocytosis, pinocytosis, receptor mediated, so a subtype of endocytosis. Then vesicle formation, same, it also has vesicle formation. In pinocytosis also there is a formation of vesicle. Energy required, yes, both the process require energy. Then example for this one is white blood cell engulfing, that is phagocytosis. Then here intestinal cell absorbing, that is nutrients from the fluid.